In this video, I will guide you through how to properly delegate insulin administration to caregivers in the appropriate settings. We will focus on helping you understand the legal requirements, safety tips, and best practices around insulin delegation in appropriate settings in Washington. This is a critical nursing task that must follow Washington nurse delegation rules and protect the safety and well-being of the clients we serve. By the end of this video, you will understand when insulin can be delegated, the caregiver's responsibilities, and the nurse delegator responsibilities. In Washington state, insulin administration can be delegated by a registered nurse, but only under the following conditions. The caregiver must have a valid credential as an HCA, NAC, or NAR, have completed the 9-hour nurse delegation core training, have completed the 3-hour nurse delegation special focus on diabetes course, and be working in a setting where nurse delegation is allowed, like an adult family home, in-home setting, supported living, or other approved community-based settings. Before you can delegate insulin, you as the nurse delegator must assess the client and confirm that insulin administration can be safely delegated and that the client's condition is stable and predictable. You must also assess the caregiver, observe their skills, and ensure that they are competent in dialing the correct dose on the insulin pen, using insulin pens correctly, performing finger stick blood glucose testing, and be familiar with recognizing signs of hypoglycemia and hyperglycemia. The delegator also must provide written instructions that are clear, client-specific, and include the type and dose of insulin, time of administration, and steps to take if blood sugar is out of range. In my own insulin administration delegation training, I supply caregivers with a training pad and a clean insulin pen that I have filled with water, and I have them practice placing the needle on the pen and injecting. This helps to build confidence and refine their technique through repeated practice without risk to the client, and it allows them to demonstrate the steps back to me, both physically and verbally, after I've provided the initial instruction. When you observe the caregiver performing the task, you must directly observe and evaluate the caregiver's technique before you approve them to perform insulin administration. In Washington state, the frequency of nurse supervision for delegated insulin administration is governed by the Washington Administrative Code, or the WAC. According to this regulation, the registered nurse must supervise and evaluate the performance of the caregiver with delegated insulin injection authority at least every 2 weeks for the first 4 weeks. After the initial 4 weeks, supervision is required at least every 90 days. These requirements ensure that the delegated task is performed safely and competently, with the nurse providing the appropriate oversight. It's crucial to adhere to these supervision intervals to maintain compliance with state regulations and to protect your nursing license. For more detailed information, you can refer to the full text of the WAC. There is a link in the description of this video. Remember that adjusting insulin dosages based on clinical judgment is not a task that can be delegated. The dose must always be given exactly as ordered or adjusted per the sliding scale if applicable. Administering insulin without documented delegation orders or independently making clinical decisions regarding glycemic management falls outside the caregiver scope of practice and poses a significant patient safety risk. Caregivers should never skip or change the dose or administer insulin if they feel unsure or unprepared. Caregivers who are delegated in insulin administration must follow the nurse's written instructions exactly, accurately document each administration, monitor and report any side effects or unusual symptoms, and recognize and respond to signs of low or high blood sugar. These resources are kept in the delegation binder provided at each home where I delegate. My delegation binder includes copies of relevant WACs, client-specific delegation forms, and quick reference guides to help caregivers stay compliant and confident in their caregiving role. If you're a caregiver, be sure to ask your delegator where this is kept. As a nurse delegator, your responsibilities include providing clear, complete, and client-specific written instructions, verifying caregiver competency, monitoring the client's condition regularly, maintaining documentation of training and delegation, and be available to respond to caregiver concerns and questions. You are legally and professionally accountable for the delegation process, so never skip steps or assume that a caregiver just knows what to do. Strong communication is essential, so make sure that caregivers feel comfortable asking questions. I'm not going to walk through the step-by-step process of giving insulin in this video because that specific hands-on training is the responsibility of the nurse delegator, who will teach the correct technique based on the type of insulin, delivery method, and the client's individual care plan. Every client is different, so your delegator will make sure that you are confident and competent before assigning the task. Just a reminder that insulin pens are client-specific. Never use one client's pen on another client. Insulin is a high-risk medication. Always follow the care plan and delegation instructions exactly. When in doubt, call your delegating nurse. Thank you for watching and for doing your part to ensure safe, effective care for our clients. If you have any questions, don't hesitate to reach out to your nurse delegator. Your insights could really help another caregiver or delegator watching this, so feel free to share your thoughts below. The relevant WACs for this video are in the description.